Hello, I'm Lyudmila Shively, a nursing student at Indiana State University. Today's presentation is entitled Health Promotion and Disease Prevention for the Most Vulnerable in Hamilton County. If you are watching this presentation, you might ask yourself, am I considered to be at risk? If you are age 35 to 62, have no medical insurance, have insurance with very high deductibles, or generally cannot afford regular medical and dental checkups, you are considered to be at risk. You're not alone because roughly 17,000 people in Hamilton County are in exactly the same situation. This presentation will give you little advice about inexpensive ways to live a healthier life. After viewing this, you will understand how to implement proper oral care, apply healthy diet recommendations while purchasing food, understand the importance of regular exercising, understand how to perform a number of self-examinations, understand the importance of adult immunizations and screening, and realize the financial and health advantages of smoking cessation. Before getting down to the business of making a healthier you, let's find out what you already know about healthy lifestyles. Please pause the presentation for a few minutes and take this brief quiz. Write down your answers so you can see how much you have learned by the end of this presentation. Let us talk about your mouth care first. The American Dental Association recommends brushing your teeth at least twice a day for 2 minutes with a soft toothbrush to help remove food particles and bacteria that can cause disease. Use a pea-sized amount of toothpaste for each brushing. Teeth can be brushed before or after meals with one condition. It is important to wait for 30 minutes after each meal, as brushing too soon can damage the enamel of your teeth. A toothbrush should be replaced every 3 to 4 months or sooner if bristles are damaged. Using mouthwash is important, but be sure not to swish your mouth right after brushing your teeth, or it will wash away the concentrated fluoride in the toothpaste left on your teeth. Choose a different time to use mouthwash, such as after lunch. And remember not to eat or drink for 30 minutes after using a fluoride mouthwash. Flossing should be done at least once a day. Ideally, you should floss after every meal. Despite having more healthy options than ever before, Americans as a whole eat poorly, loading up on fats, processed sugars, and carbs. This diagram shows how you should build your dinner plate. Portion control is a real problem too, as many people choose to upsize when they can. Keep these ideas in mind. A daily serving of pasta is the size of a tennis ball. A serving of cheese is the size of 3 dice. A serving of meat is about a deck of cards. A serving of nuts is golf ball sized. Calories are important too. Women should consume between 1600 and 2400 daily, while men should aim for 2000 to 3000. Being physically active means being able to do all the things you have to do each day, such as working and family activities. The American Heart Association recommends 150 minutes of moderate exercise weekly, like walking for 30 minutes every day during the work week, or 75 minutes of vigorous activity, such as running 3 times a week for 25 minutes each. You can benefit from a 15-minute walk around the neighborhood twice a day. You'll find that exercise has many benefits: controlling weight, managing stress, and boosting your immune system. It is important to remember some precautions. First, start exercising slowly and progress gradually. Allow time to warm up and cool down. Second, it is better to exercise before eating than right after it. Third, exercise until you're breathing deeply, but not out of breath. If you smoke, you need to stop for many reasons. According to smokefree.gov, your health begins to improve literally in minutes, with your blood pressure and heart rate returning to normal levels. After a decade as an ex-smoker, your lung cancer risks are the same as a non-smoker. But you can save more than your health. A person who smokes one pack a day can save up to $2,000 a year. Quitting is not easy. There is more to it than just not smoking. You need to make a decision to become an ex-smoker. You can get help if you're ready. Indiana's Tobacco Quit line offers free, confidential help with kicking the tobacco habit. To protect your health and prevent disease, you need to consider your immune status. There are a variety of immunizations that the Centers for Disease Control and Prevention recommends for adults. For example, varicella. If you didn't have chickenpox as a child, you need 2 doses of varicella vaccine. Herpes zoster vaccine is given after 60 years old to protect you from shingles. Or TD/TDAP. This is protection from tetanus, diphtheria, and pertussis, and it is received once, followed by booster every 10 years. One very important vaccine that is given once a year is a flu shot. It's supposed to protect you from influenza, and the best time to get it is fall. Talk to your doctor about what immunization you should receive. Vaccines can be costly, but some clinics, such as Hope Family Care Center, can provide them at low or no cost. It is not easy to detect back changes in your health early enough, but we are talking about a matter of life and death. It is important to do some self-assessments even if you don't feel discomfort or pain. This slide shows you how to do skin self-assessment. It is done in a well-lit room, in front of the mirror, after a bath or shower once a month. This exam can help find many skin cancers early, when they are easier to treat. Women need to do a breast self-assessment every month during ovulation, which is around 2 weeks before the next menstrual period. This slide contains self-explanatory instructions how to check yourself for any changes such as lumps that were not present before. If you find something unexpected, it is time to go to a professional. If you find something unusual during your breast self-exam, you need to schedule a mammogram. This radiological screening test can detect early breast cancer. Free clinics such as Hope Family Care Center periodically offer these tests. According to American Cancer Association, if you are between the ages of 40 and 54, annual mammograms can be helpful in catching breast cancer early. Women over 55 can cut back to having a mammogram every other year. Also, women over 21 should be screened for cervical cancer every 3 years through age 29. From age 30 to 65, testing can be done every 5 years. If you feel sick, you can go to free clinic. There are several free clinics in Hamilton County that can help you with routine checkups, minor medical problems, and even dental issues. Their hours are limited, so pause this presentation and record the contact information for the one nearest you. Sometimes health problems can get out of hand. If you are in need of serious treatment, go to the nearest emergency room. Pause this presentation and write down the contact information for the one nearest you. Let's see what you have learned. Pause this presentation to take the follow-up quiz.